the heart of Yorkshire.
Red phone.
Hello, Barnsley A&E.
An unbeatable team.
1, 2, 3.
Hard at work 24 hours a day.
I feel like I'm on Titanic and bows just lifting up out at water.
7 days a week. Saving lives.
Hands across your chest, Mary. We've got you.
Helping loved ones.
Well, have you looking beautiful again?
Didn't expect to be losing part of my body today.
Making the community they serve better.
I thought I'd do it up. Oh, you're okay.
All staff's been brilliant.
A health service treating anyone.
You'll need to see a doctor.
You'll find out that I'm an idiot.
And everyone. A team doing anything and everything for each other.
Sweetheart! Hey!
This is Barnsley Casualty 24/7.
The National Health Service might not be perfect, but thank God we've got it.
Another life saved.
On shift tonight, Dr. Rebecca Graspy.
Should we crack on then?
Yep.
Get it fixed? All right, good stuff.
Junior Dr. Josh Gemmell.
You're the happiest child I've seen today by quite some margin.
And emergency nurse practitioner Becky.
Can be small, this one, and they just bleed like bilio.
So get ready to share a shift with the team at Barnsley Casualty. Sister Vicky has only just clocked on this morning, but she's already got her first dose of bad news.
Apparently 100 people picked it up between 5 and 10 last night.
I've come on shift this morning. There is currently 45 patients in the department. It is over a 10-hour wait for a doctor. Obviously there's no beds, no floor. It's been a long doctor wait overnight due to doctor shortages. So that's the state of play. So I don't think we're going to have a very good day today.
And it's not getting any better.
Hello, Barnsley.
A lorry has tipped over on its side in a country lane. The driver is being rushed in. Dr. Graspy heads to Ambulance Bay 16.
Hi, Carl. My name's Rebecca. I'm one of the doctors here at Barnsley A&E.
Oh, yeah.
What happened then?
I was going down this, it was narrow.
Yeah.
Car coming towards me with bikes on back.
Okay.
So I'm just giving me that little bit extra room. Because I'm on the banking, so and the sort of front wheel went that way, the whole wagon went.
57-year-old Carl has been a lorry driver for the past 30 years. His wife Diane is by his side.
Okay, and so you've hurt your shoulder, I can see.
Yeah.
Have you appeared to have hurt anything else at all?
I don't think so.
No. And do you know if you lost consciousness?
No, I didn't know.
Carl's had a very lucky escape, but Dr. Graspy still needs to quickly determine the extent of the damage.
Can you turn your head all the way this way for me and turn it all the way that way? Was that painful or difficult to do at all?
No.
Can you sit your head forward slightly for me so I can feel your neck? Any pain in your neck at all?
No.
Shoulder here?
No.
Shoulder here? Yes, yes. So I won't press much harder than that. I think I know that hurts, don't I? Any pain at all along the arm itself?
No.
And as I move up to the shoulder?
No, not really.
No, it's there, isn't it? It's the back of your shoulder.
Carl needs an X-ray.
Should we crack on then?
Yep.
Get it fixed? All right, good stuff.
If Carl has dislocated his shoulder, the longer it's out of place, the greater he's at risk of severe tissue damage. In the hub, Sister Vicky is battling a backlog of patients from a busy night shift. And now, Barnsley is waking up.
Yeah, any potential discharges from up there now? Or to ward round?
So she's desperately trying to free up some space somewhere. Anywhere.
Note. All right then, my love. Thank you. Cheers, love. Bye, bye. So that what sister up on AMU. She's only got one female bed in medical side. AMU is an acute medical unit, so they will then assess and treat their patients there. So when there's no beds on AMU, obviously it's a big impact on us because we're having to bed down our patients and become basically a ward area as well as an emergency department.
While Sister Vicky battles double the workload, the emergency red phone is ringing again. Paramedics are blue lighting in an 82-year-old who was found collapsed at home. Once in the ambulance corridor,
Right, Ron. We're going to put you in on the bed.
Oh, ready, sorry. There we go. You dog. Well, thank you.
You are more than
Shall
welcome.
we do it again?
Why not?
It was such a wonderful experience.
Ron may be happy with the service, but paramedics are concerned that he's showing signs of confusion.
I fell, and we are always told, aren't we, that most accidents happen at home.
Dr. Jake Mullen is immediately called.
Hello.
Hello.
Nice to meet you. I gather you had a fall on the floor and you can't remember what happened. Do you have any idea what time you fell?
The nearest I can give you is 5:30 a.m.
Fine. Because I've not met patients before when they come in, it can be really hard to assess what they're usually like, what their usual demeanour is. Okay, so what I'm going to do, I'm going to keep on having a chat with you, Ron, but I'm going to take some blood at the same time. Is that all right?
Yes.
Cheers. Thanks. Part of my job is to assess, are they confused? Are they in an okay mental state? And now we need to send you for a scan of your head.
Yes.
Dr. Mullen needs to find the reason for Ron's fall.
I'm going to give you an address and I want you to remember it, okay? And at the end of the conversation, I'm going to ask you again.
The blood test will show if an infection is the cause. And he also starts to test for concussion.
So that address is 42 West Street. Commit it to your memory, my friend, okay? What year did First World War start?
1914.
Perfect, okay. What's the name of the current monarch? This will throw a few people.
Yes. Charles III.
Well done, well done. And what was that address?
42 West Street.
Yeah, he's pretty sharp actually, to be fair. Would you mind if I just take a quick look at you?
Ron's recall might be unaffected.
Follow my finger. Are you taking him for a head scan?
Yeah, we are, yeah.
Yeah, do you want to just go ahead?
But Dr. Mullen can't rule out some form of brain trauma.
Afternoon.
Good afternoon. It's nice to see you.
He's taken up to the scanning room to check for a bleed on the brain. Casualty is jam-packed with patients from the night before. Some are still waiting to be seen. Others need a bed.
Hello, have we got any male surgical beds? No, a minus.
That means it's double trouble today for Sister Vicky.
No, there's minus males in surgicals. So he's staying there until... but just ask Marie just to check again this afternoon. Oof, so when I have a busy shift, obviously I do like a nice smooth running shift, but that never ever happens to me.
She's asked consultant Dr. Claire Guinness for some help.
Rammed.
We are. Things like this, I will try to chase. And what I'll do is, once I've got a handle on it, ring the med reg and ask them if there's no beds, they're going to have to come down and start carting down.
And I'm going to just speak to guys on ambulances and see if they can inform their CS just to let them know what's happening. It's so difficult to predict what your shift is going to be like. You can never expect coordinating the same sort of style every day because obviously everything's dependent on the department.
While Sister Vicky works out her next move, lorry driver Carl is waiting in radiology with a suspected dislocated shoulder after his truck tipped on its side driving down a country road.
Well, a bit shook up. But just this pain in shoulder, that's all it is now. I've been driving 30 years, yeah. These things happen, I suppose, you know what I mean? So, you've got to be positive, ain't you?
Hello, Carl. I'm Beth. We're doing an X-ray of your shoulder, all right?
Very good.
This way. And we'll have to just sit you up a little bit. Okay, that's brilliant.
Just there.
Yeah, perfect.
With the x-rays complete, Carl is wheeled back to a cubicle. In the hub, the findings don't seem to be as straightforward as Dr. Graspy hoped.
I'll prescribe him some morphine. Hello again, Carl. Hello. How are you?
Good.
So I've had a look at your x-ray, and because the x-ray looked suspicious of a dislocation, but it wasn't completely convincing, what we are going to do first of all, though, is give you some good painkillers and see if we can move it around a bit better. When you're uncertain about the diagnosis, you do feel that pressure, not only from the kind of pressure of how busy the department is, but also in wanting to make sure you do the right thing for the patient as soon as possible.
Quickly, Dr. Graspy gets Carl, along with his wife Diane, moved to Resus. Dr. Graspy knows she doesn't have time to waste.
The things that you worry about with any joint dislocation, especially in the limbs, is that if they're significantly out of place, they can cause some damage to the blood vessels and to the nerves. So because of that, you can get some issues with the sensation and the power of your hands and your arms. So the reason why if they're out of place, you want to get them back in as soon as possible is so that it doesn't damage any of those associated structures and cause any long-term complications.
But with no concrete diagnosis yet, time is ticking for Carl.
Are you going to come up and we'll bring you a bit more comfy?
Thank you.
Patient Ron has been sent for an emergency CT scan to uncover any signs of potential brain damage caused by the fall.
Start with your in, everyone.
Down in the hub, Dr. Mullen has just uncovered something else.
Big Ron fan.
His patient's full name.
Dr. Ron Harry Weasley Potter.
Has he changed it on Mac?
Well, yeah. It's
Unless his parents are massive Harry Potter fans.
He's 82.
82, that's way before.
No.
Has my name officially, i.e. legally, been changed? The answer is yes.
He's an interesting guy. Apparently he changed his name 20 years ago. And yeah, he's also a professor of music, apparently. So I think he's a little bit of an eccentric.
So far, the Harry Potter fan is not presenting as a textbook case.
So when I'm chatting to Ron, his behaviour's slightly unusual in the sense that at times you can seem a bit confused, but when I've tested his memory, everything seems to be in order. It may be because he's slightly unwell, it may be because he's had a fall earlier today, but it's not entirely clear what's going on. Oh, there we go.
The blood results are back.
I need to have a look at the rest of these guys' bloods.
But there's another surprising twist to this tale.
So, Ron's bloods have just come back, and they're suggesting that he may well have had a heart attack. So, a little bit of bad news, I'm afraid, Ron. Well, something that's concerning me anyway. One of your blood tests, a blood test called troponin, is really, really high. And that is most of the time indicative of a heart attack. If you have had a heart attack, that could have been the thing that made you collapse in the first place. Have you had any chest pain at all?
I'm just trying to look back down the corridor of time.
Yeah.
And, no.
Fine. I can't say for sure, but we'll need to keep you in, definitely. And I'm also going to go get you attached to a cardiac monitor as well, so we can keep an eye on your heart. Is that all right?
Yes.
Okay, good stuff. Let me get that all arranged.
Okay.
Thanks.
Thank you.
Yeah, she was here and now she's gone.
I think the next few days, and he can't tell me how long, are likely to be a bit dull.
It was later confirmed that Professor Ron Harry Weasley Potter did have a heart attack. He's now back home, enjoying watching his favourite movies again. Over in the hub, with a backlog of patients from the night before, it's all hands on deck for Sister Vicky.
Yeah, I like it, to be fair. I always try and get hands-on. Don't test Samantha.
She does. She's a good one.
I don't like to sit at that computer all the time.
It's boring.
Oh, here we go, love. We've got you a pillar.
The experienced sister knows there's only one way to get through days like today.
It's just a case of all pulling together, just trying to keep on top of all his jobs as nursing care, making sure his patients are fed and watered.
While Sister Vicky tries to keep her patients as comfortable as possible, away from the hub is the paediatric wing of Barnsley Casualty.
Lost it.
Where specialist children's nurse Greg looks forward to coming in every day.
I love the sense of community that's in Barnsley. Never experienced a team like it. Everyone's so friendly. We've got Esme. Everyone's so eager to help each other. My name's Greg, I'm one of the nurses. Do you want to follow me? Hello, Esme. It's such a lovely place to be, and it really makes every shift enjoyable. Just want to pop her on this chair just to weigh her.
And after working here for 3 years, he knows just how to get the best out of everyone.
Working in paediatrics, you have sort of got two patients. You've got your patient with a physical complaint in front of you, and you've got the parent who obviously doesn't know what's going on. If you explain everything thoroughly, I think parents tend to be a lot calmer, and you can just see the anxiety and the worry dip down throughout the whole stay. Right, missus, come in here.
Time to put that into practice with worried mum Chelsea, who brought in her daughter Esme, who's nearly 2.
So run me through what's happened, Mum.
She was at Nan's.
Yeah.
She's fallen over in the garden. She basically just set off running, tripped, fallen, banged her head.
Lovely. Has she fallen on anything pointed to get that, like stones or anything like that? Or do you don't? No, that's fine.
I just know it's concrete.
Yeah, that's fine.
You know, if, say, it was concussion,
Yeah.
how long after would she straight away been sick?
So, normally within the first 4 hours is the time that we watch out for vomits or anything like that. I would imagine that if she was going to be sick, she would have been sick already. The sleepiness afterwards is fine. It's all the adrenaline rushing around and everything like that.
All right.
The fact she's alert and everything like that, I don't think we've got anything to worry about. We'll be all right.
Although Nurse Greg is able to reassure Chelsea about possible concussion,
Let's go.
And she's got a good egg on her head.
I know.
You know, doctors will have a proper good feel of that.
the size of the lump on Esme's head is of concern.
Thank you very much.
Come on, sweetie. Hello. We'll see, Nanny.
Over in Miners, 28-year-old Kyle and his partner Becky are waiting to be seen after he sliced his fingers.
Right then, is it Kyle? Come through.
Emergency nurse practitioner Becky is available to see him.
So my name's Becky, I'm one of the nurse practitioners, so I'll be having a look at you. Is that all right?
Problem.
Are you left-handed, right-handed?
Right-handed, unfortunately.
And what have you been doing?
I've been slicing a cucumber, but on like a slice.
Okay.
And I've sliced
And you slipped and slashed your fingers. How many fingers?
2. Little one, and then...
On your right hand? Yeah. They bleed quite a lot when you first did it? Yeah? Yeah. Just relax, just let them go and just relax them a little bit, because once you relax, it'll all just start to pump anyway, so just give it a minute. Any numbness or tingling or anything in them?
They're just throbbing at the minute.
Throbbing?
Yeah.
Okay. What were you doing, making lunch?
Yeah.
These things are sent to triers, aren't they?
Mm-hmm. You don't even like cucumber?
No.
Oh dear. Really? Right, pop your hand on there for me. Just turn your hand over. It's the pouch.
Just don't look, Kyle.
Sitting.
So, before we have a look, can you feel me touching these two?
Yeah.
Yeah? They both feel okay. They probably don't feel like that, but you can feel me. Yeah? Can you bend that one in for me? Keep going. Push in, that one. Bend, bend, bend. Lovely. Turn them, but put your hand over now. And can you push up? And you can feel me, yeah? Right, so what you've done is, the reason why it's bleeding is, you've taken off basically the top layer of the skin, the pulp of both the fingers. It can be the smallest wound, this. I mean, they're quite the good ones, to be fair, they're not bad. But it can be the smallest one and they just bleed like bilio. They absolutely bleed because your hands are quite vascular. Just turn over again, let's check your nails. So you've caught just the edge of the nail with that one, haven't you?
Stinging.
Yeah. Well done. So I wouldn't have thought there'd be any bony involvement. I think we'll just do a quick x-ray just to be sure, all right? Is that okay? Just because I think that the ring finger's fine, but the little one's probably just about on knuckle. I won't want to send you away just with a dressing if you've got bony injury, if that makes sense. So I'm just going to put your temporary dressing on while we get for an x-ray. And then if it's fine, what I'm going to do is I'm going to put a special dressing on. They call it Caltostat, and it clots, basically. It just clots the blood.
You're on tea duty from now on.
Yeah.
After what?
I'm on tea duty.
Dinner.
Yeah.
And that's not been partner Becky's only duty today.
You kept things, didn't you?
Yeah.
Just in case.
Yeah, it's just ice with little bits of finger. It's a bit disgusting, to be honest.
Oh no, it's too small.
Yeah. I figured it might be, but I thought, you know what, it's just better to bring it rather than get here and be like, oh, did you fetch it? You can sew it back on. No.
If Kyle hasn't any bone damage, his wounds will take up to 4 weeks to heal.
What you have to think is, you've got skin loss,
Yeah.
so there's nothing for me to close back up.
Yeah.
There's no edges to put together to stitch or to, you know, anything like that. So it's just a case of your body's just got to grow fresh skin. So that's why they're slow healers. Right, so back to reception, turn right, through the black door to X-ray, both of you, and I'll see you when you get back. You can put it in that bin, yeah.
It's ready, sister.
In the clinical waste one.
Yeah. There you go. Yeah.
Thank you very much.
Good thinking, though, that. No, you're very welcome.
As Kyle heads to see what damage he's done to his fingers, back in the hub, Sister Vicky's still up against a very busy department from the night before. All she can do for now is try to keep them well fed and watered.
When you get 2 minutes, will you do a tea and toast round for me, love?
Meanwhile, over in Resus, is lorry driver of 30 years, Carl. He came in earlier today after his wagon tipped over on a country road.
I do like working, yeah. My boss likes me to work.
After x-rays, there is no clear conclusion on his suspected dislocated shoulder. The only way to get a full diagnosis is to try and move it. And that needs very strong pain relief.
Did you have gas and air away here in ambulance? Yeah. Well, this is a bit similar to that, really. It's a quick acting inhaler pen that you just sort of breathe it in. Right. It'll make you feel more relaxed to help, get your shoulder back in. And it's dealt with pain as well. So shall we cut your top off?
Yeah.
Are you sure? Yeah. Chop it, yeah? I already cut it. Oops, dears, we said don't chop it.
Nurse Sam cuts his t-shirt off so the team can get better access to his shoulder.
How are we getting along?
Dr. Graspy, who's in charge of Carl's care, checks in.
How are you finding with pen frocks?
I don't know if he's had enough of it yet.
You got to really go for it. Yeah, think of like, your life depends on it.
Big breaths in and out.
I've been a doctor for 4 years. I've always had an inclination I want to see some people, and I think something like working in A&E is especially good for that. On any given shift you can meet so many people with different stories, different backgrounds, and having the opportunity to try and help them in some way.
How's the shoulder?
It still hurts.
Still hurts? Yeah. Okay, right. So let's have another little feel of it, if that's okay. Because I've gone and spoken to the radiographer, who's the person responsible for reporting x-rays, and she doesn't think it is dislocated. So now we've got this whole debate that's coming up about whether or not it is truly dislocated.
With Carl in particular, there is some uncertainty about what's causing the pain in his arm. Sometimes it takes longer to get to the diagnosis, but until we know exactly what it is, we can't fix it, we can't help him.
Do you think you can try bringing this arm across to that shoulder? So it's painful, isn't it? Is it that painful at the back there?
It's painful, yeah.
So I think your movement is good. Obviously it's painful, so you've injured it in some way. I'm just not convinced you've dislocated it.
Right.
All right, so I'm going to go speak to my consultant again.
I'm concerned with this lump on my front.
Lump on your front?
Is it the...
there?
Yeah.
Is it tender when I press it?
No.
No. Okay.
Carl's new concern has Dr. Graspy reassessing his injury.
Okay.
She calls in Dr. Guinness for advice.
I think you have broken your clavicle, my friend. Now that bruising is coming out.
That was a
I
lovely
press there.
feeling.
Yeah. Oh. You're sore everywhere.
The team could have finally got their diagnosis. But depending on how severe the break, Carl could need surgery. In Barnsley Casualty today, Sister Vicky is still dealing with the after effects of a busy night.
Scott?
Morning.
You alright, love?
How's things?
It's just obviously we've got no flow, because obviously we're an 11-hour doctor wait. No flow upstairs, is there?
To make matters worse, there's been an influx of walk-ins. Sister Vicky and Dr. Guinness now have more patients in the department than when they started.
I'm known as the pool magnet, so quite a lot of staff know that they'll have a laugh and a joke and say, oh God, Vicky's on, we know what kind of shift's going to happen. It's just trying to get through it, and sometimes you're trudging through treacle.
We're about to get 3 more, so we're still trying to get to the end. But we always do, we find a way.
While they try and stay positive, Kyle and his partner Becky are waiting in radiology.
Just leave it.
After he cut his fingertips off on a food slicer, making their lunch.
I didn't really look, did I? I just put it straight on the tap. And then you wrapped it up in kitchen roll. Yeah. And I said I weren't looking. Just sat on the settee.
I was like, just don't look.
Kyle heads in for his x-ray with radiographer Hamza to make sure he's got no bone damage.
What have you been doing then?
They're on like a slicer, so as I've been doing that, it's got short and I've sliced.
Technique needs just a bit of work.
Definitely. I need to use guard that come with it.
Keep still then.
With Kyle's x-ray all done,
job's so good.
Thank you very much. Yeah? Cheers.
He gets sent back to Miners to see emergency nurse practitioner Becky.
You've been keeping it elevated?
Yes.
Good.
Take that.
Come and have a seat.
Please.
Right, so I've got your x-rays on the screen here.
Yep.
So this is your little finger here.
Yep.
So you've got 3 bones in your finger. You can see how near it is to the bone. That's why I wanted to be sure, because like I said, if it were any nearer, so if it were exposing it, then we'd have to give you antibiotics, but it isn't. But you can see there where you've chomped away a bit on that one. So we just need to give them a clean, get this special dressing on,
Yep.
get it elevated.
Yep.
If it stopped, we'll have to send you on your way straight away, but if not, I'll have to sit you outside probably for 20 minutes and just check that it's not come through. There's no point in going all the way home and then having to come back. All right, so let's have a look.
Keep it up.
It's just that little one, I think, that's going to start. Other one's clotted, I think.
With no permanent damage, Kyle wants a memento.
You're a strange man.
You want to check them then?
Yeah. There you go, you've got your memories. That's it.
That's going on first.
Yeah.
Then the special dressing goes on to stop the bleeding, to clot. And I'm just going to put some pressure on for a few minutes. Are you okay at that?
Yeah, that's fine.
Your little pinky.
Aye. Closest to the chopper, yeah.
Emergency nurse practitioner Becky dresses Kyle's cuts.
Keep that one straight for me.
Sorry.
That's it.
You just come from GP.
Oh, yeah.
Yeah, well, yeah,
For
because
me, not you.
she's pregnant.
How are you? Lovely. How far on you?
24 weeks.
You first?
Yeah.
Yeah.
Are you going to find out what you're having, or?
No, we're trying to keep it
A baby. You're having a baby?
Yeah, exactly.
So, I've put that on quite tight.
Yep.
I've bandaged them together.
Mm-hmm.
Don't be doing too much of this while you're sat out there. Still remain nice and chilled, and you're not pumping that blood through.
Mm-hmm.
And we'll get you back in 20 minutes and we'll have a look at it.
Right, thank you
Okay,
very
any
much.
questions?
No, I don't think
Oh, thank you.
No? Okie dokes.
Thank you.
You're welcome.
20 minutes later, they were allowed home to finally eat their lunch.
Not using that slicer again.
In paediatrics, 23-month-old Esme has a very big bump on her head after falling over in her nan's garden.
Hello there. Hello.
Dr. Josh Gemmell wants to take a look.
Come on then, you. Shall we go and get you sorted out? Right then. My name's Josh. Nice to meet you. Hello. So this is Esme, obviously. You're the happiest child I've seen today by quite some margin. We'll see if you're still happy once I finish with you, of course.
Yeah.
So, with head injuries, is the damage outside? Is the damage inside?
Yeah.
Those kind of basically are two main areas of concern. There's quite a large swelling there.
Yeah.
And I can see on this side, oh, can I have a little look at your ear? Would that be all right?
That way.
A little look at your ears.
That way.
What's this? Perfect, yeah. So there's no like little half-moon bruises behind the ears. Bruising behind the ears and a little bit of blood behind the eardrum can potentially be signs of a base of skull fracture.
Okay.
So I just need to have a little look in your ears, little one. Shall I have a little look in your ears?
That way.
Shall we get Mum? Do you want to sit on Mum's knee? Yeah. And then we can sort of cuddle your head into...
This way, look this way.
That's really good. Well done.
There he is. Still.
Tickle your ear.
Well done, baby. Still.
Perfect. Well done. And shall we have a look at that one?
Ready?
And the other one.
Come on, mate. Come on, mate.
You're being so brave, sweetheart. It's lovely. It's brilliant. So that's fine. So no blood behind the eardrum.
Okay.
Let's have a little look at this now.
Ready? Good girl.
Being very good, aren't you? So,
No, baby.
Yeah.
Hey, look, you're on Mummy's arms.
That's okay. Well done. Well done. Oh, you didn't like that very much, did you? So you can tell it's obviously quite tender, but actually there's no kind of bogginess when we're having a press in there. So, again, I don't think there's anything to suggest that she's kind of had any focal skull fracture there. And if you're going to hit yourself somewhere on the head, it's a pretty good place to do it.
Okay.
Obviously, not something we'd hugely recommend, but if you are going to, that is the best place to have a high five. Yeah. And with the other hand, high five. Boom.
More reassurance for Mum Chelsea. So now she can move on to her next concern.
In terms of swelling,
Yes.
is there anything you could suggest for that to help?
Well,
or just let it go on its own?
It's kind of going to be a case of it going on its own.
Okay.
It's really.
Will the bump still be there for Esme's birthday in a fortnight?
To be honest, trying to put loads of cold compresses and that kind of thing on are probably going to be a bit more trouble than it's worth, really.
Right.
And it will go down.
Yeah,
It's
that's fine.
going to look a little bit funny for a few days.
Yeah.
It's already healing over, actually.
Yeah, it is,
It's a relatively small wound that should heal up really nicely. And I think if we start scrubbing at it,
Might make it worse.
yeah, exactly. So I think we'll leave that as it is for now.
That's good news all round. Esme's bump cleared up in a few days, and she was in perfect shape for her birthday party.
Bye.
Over in the hub, some good news at last for Sister Vicky.
So Dr. Waite's come down lovely. It's to come down from a 11-hour to a 7-hour Dr. Waite. We've got 60 patients in department. We are not overrun with ambulances, which is brilliant. We've still got a couple of walk-ins coming in, but majority of them are minor injuries, so our EMPs are seeing them. We've got a few for GP, so hopefully, fingers crossed, we can get on top of it.
But although the numbers coming in have slowed down, Sister Vicky still doesn't have enough places to move patients on.
My priority is just keeping patients safe, fed, watered, make sure that they've got the pain relief on board, making sure that my staff are safe and that everybody's happy, and see what we can do.
Having had an x-ray on his collarbone, Carl is back in resus and seems to be feeling the effects of his strong pain relief.
Like he's got a big bite.
They've cut my t-shirt up over cut my shorts off because I ain't no underpants on.
In the hub, it doesn't take long for Dr. Graspy to get back his x-ray results.
So you might need a medical degree to be able to tell, but his collarbone is in 2 places. So we think we've solved the problem with her. So I'm going to go and tell him the news.
Hello. I'm smiling because we've solved the mystery.
Right.
It's a broken collarbone.
Lovely.
It was in the end, yeah. So what we're going to do is we're going to pop you a proper sling on. We call it a collar and cuff, and that'll put it into a position which will be really comfortable.
Yeah.
That'll be the most effective painkiller. But also I'm going to give you some codeine to go home with.
And if you do find that struggling more with the pain, if you're getting any sort of numbness, tingling, any change to the colour or temperature or something seems off with the arm, pop back and see us, but it should be okay.
After having a sling put on, Carl is finally able to go home, minus his t-shirt.
So that's it.
Right.
You're good to go now.
All staff's been brilliant. When the actual crash happened, all the people that stopped and come and helped me, they've been brilliant as well. Thank you very much for that. Yeah.
He's now under the fracture clinic's care and hopes to be back to work in 6 weeks. In Casualty today is Dr. Kelly Chappell.
Hi Graham, I'm Kelly, I'm one of the doctors.
Oh, hello Kelly.
Hello, how are you doing?
Nice to see you.
You too.
Dr. Chappell is seeing 84-year-old Graham, who's brought himself in after suffering from stroke-like symptoms a few days ago.
So what's brought you into A&E today?
My fingers went numb.
Okay.
I immediately thought that I'd been resting them on something and a nerve had got trapped.
Yeah, okay.
Okay?
Yeah.
And then I started to be unable to pick my words. Okay. I don't mean forgetting them. That's normal when you get to my age.
Yeah.
But I couldn't really articulate them.
Yeah.
They just wouldn't come out. I began to get worried.
Mm-hmm.
Graham has community nurses that come round regularly.
The nurses came to change my catheter.
Okay.
And I explained to them that, sorry, you know, I'm not quite round, I'm still waking up.
Yeah.
And anyway, I've had a bit of... when they said, oh, we need to look.
So that you'd come in today because you told them what happened on Monday and then they were concerned?
They advised me, well, they said I must.
Yeah. Is it okay if I examine you? I'll just pop you on this
yes, of course.
trolley. Is that okay? I'll just put this sheet down. Can you feel me touching you?
Yes.
Any numbness at all in your hands like you said before?
No. No.
No?
No.
Good, okay. Now we're going to do some facial expressions. So I'd like you to squint your eyes as tight as you can. Good. Now blow up your cheeks. Good. Now give me a big smile. Good. Raise your eyes.
84 years old, these. Well, -5.
Raise your eyebrows. Good. Okay, right, let me put this down so you can sit up. Fine. I just also didn't ask, have you had any falls or like injured your head recently?
No, I don't have falls.
You don't fall.
I'm very careful.
Good. So you can sit back up. You can go back on the sofa wherever you feel more comfortable. Okay. So I think you did the right thing by coming to A&E because the symptoms that you've described could be another TIA. However,
a stroke.
Well, a mini stroke. Because they've gone away. Yeah. If it was a kind of full-blown stroke, we'd normally see the symptoms would persist.
Yes.
The thing that I'm a little bit upset about is that you didn't come on Monday when it happened. I'm glad that those nurses told you to come up here.
Yes.
So what we need to do is get a CT scan of your head just to make sure that there isn't a stroke. You don't take any like aspirin or blood thinners or anything like that?
I used to take aspirin, but
And
I've had
bleeding.
trouble and it's been bleeding.
Okay.
So one of your colleagues on the wards said,
When did it stop? When did you stop taking the aspirin?
probably about a year ago.
Graham stopping taking aspirin, a blood thinner, could be a reason for real concern. He's immediately sent for a brain scan.
Yes, they have, yeah. They're going. I just need to take them out. Right.
Sister Vicky has finally got Barnsley Casualty moving again after a busy night shift, which is making everyone happier.
Oh, tell me about it, Eric.
The plan she hatched with Dr. Guinness is starting to work.
They've had a really bad night, so the team have done an amazing job at just trying to keep people safe and see the most poorly patients. And everyone's been very patient who's had to have a long wait, so we're doing our best now to try and catch up, get everybody seen.
In radiology, waiting for a CT scan, is Graham.
What have you been doing then?
Well, they think I might have had a little mini stroke.
All right.
And I think they're just trying to find a solution to it happening again, if that is possible.
If Graham has had a mini stroke, which is known as a TIA, it could be a warning sign that he's at greater risk of a major stroke.
Come on, sir, let's take it in. And dip the light fandango.
those were the days.
And it's not long before Dr. Chappell receives the results.
So that's good. So it just says that there's some age-related changes, no hemorrhage or infarct, and no mass effect. So that's good, but doesn't mean that he's not had a TIA. So if you see here, there's quite a lot of black bits. Yeah. That's what they mean by the age-related changes, because the brain just kind of starts to change shape slightly with age and gets more space in the folds. But it's not kind of anything to worry about, it's just something that happens.
With no sign of major injuries, that's good news for Graham. But he still needs treatment for a mini stroke, which may not be simple. The usual blood thinners might not be an option, due to Graham previously experiencing serious bleeding.
The stroke is more dangerous to him, but obviously a huge bleed can also be pretty catastrophic. Right, let me try them again.
Dr. Chappell needs advice from the stroke team before she prescribes him any medication.
Thank you so much, Susie. Take care. Bye. Cool, we've got a plan. So I will just prescribe him this treatment and let him know. Graham, do you want to come back through?
Yes. Oof.
You okay?
Yeah.
Good.
I'm beginning to feel sore at the bottom end.
Because you've been sat still for so long.
Yes.
Pop in here.
Oh.
Right, so...
Right.
The good news is there's nothing kind of untoward on your scan. So you've not had a stroke.
On the brain one?
Yeah, on the brain scan.
What have I had then?
So we think you've had another mini stroke, another TIA.
Yes.
That's the most likely cause of your symptoms, especially given that you've had it in the past.
Yes.
So what we're going to do is give you some aspirin today before you go home, like the strong dose of aspirin. And then tomorrow you'll start on a different tablet called clopidogrel, which is another one similar to aspirin.
How will I get that?
We're going to give it to you.
You're going to give it to me in a box?
We're going to give it to you.
Do I take it more? Well, it will say on it, will it?
Yeah, you just take it once a day in the morning.
Yeah.
And then tomorrow at some point you're going to get a phone call from the stroke nurses from the TIA clinic, and they'll let you know what happens next.
Right. That's a good conclusion, isn't it?
Graham is now ready to be discharged.
How are you going to get home? Oh, you can't drive for a month until they've... Or if they say anything different in the clinic, then
I'm going to ask them if I can go down the village for my groceries.
I imagine they'll probably say you can't drive for a month.
I promise that I will comply.
Good, okay.
And if they say a month, it's a month.
Yeah.
All finished up, Graham is allowed to head home.
I'm all finished and I've got a draw. I haven't got a win, but I've got a draw.
Oh, good.
Which, if you're playing away from home, that's as much as you can expect.
It is.
But I would like you to raise me a taxi if you would.
Of course, my love.
Thanks a lot.
All right,
bye-bye.
darling.
Hope I don't see you again.
It's been a pleasure.
He's now under the care of the stroke team. It's near the end of Sister Vicky's shift and time to hand over the hub.
When we come on this morning, there were 45 patients in a 10-hour wait for a doctor. Obviously, there were only a couple of waiting AMU beds because nobody had been seen, but we've got no capacity or flow in hospital at that point anyway.
Sister Rachel's a lot happier than Sister Vicky was this morning.
Vicky's done a stellar job this morning. The department's in a better state than it was. We've still got a long doctor wait, we've still got lots of patients waiting, but we are making progress.
So after a busy shift, you've got that time driving home. I mean, I have my music on loud and I have a good sing-song sometimes, and you've just got to try and leave things at work.
As Sister Vicky says goodbye, she knows the patients of Barnsley Casualty are in good hands.
Life still beating in these crumbling walls. Tonight we sing where nobody sees. In the junkyard we are free. Underneath the moon silver haze, we'll embrace these throwaway days. Lost souls and cobbled parts, create art with our mended hearts. Every scratch has a story to tell, in this haven of heaven and hell. Old guitars strum a haunting tune, underneath the pale forgotten moon. Oil-stained fingers dance in grace, finding rhythm in a discarded place. Tonight we sing where nobody sees. In the junkyard we are free. Underneath